Hello, welcome to Wellbeing. I'm Graham Wilson. World Tobacco Day is the last day of this month, the 31st of May. It's a global health campaign promoted by the World Health Organization. Each year this day raises awareness about the dangers of tobacco use, exposes the harmful tactics of the tobacco industry, highlights what the World Health Organization is doing to combat it, and it empowers people everywhere to stand up for their right to a healthy life and protect future generations. On Wellbeing today, we want to look at the Which Way Quit Pack program, an Indigenous-led quit smoking program tackling smoking and vaping, the leading preventable cause of chronic disease and preventable death for Aboriginal and Torres Strait Islander people. To talk to us about the program is Associate Professor Michelle Kennedy, a National Health and Medical Research Council Fellow in the School of Medicine and Public Health at the University of Newcastle. Thanks for coming on the program, Michelle.
Thanks for having me.
Let's begin with finding out a little bit about you. Tell us about your background and how you came to be focusing on Aboriginal health and tobacco control particularly.
Well, I'm first and foremost, I'm a Wiradjuri woman and I've been raised here on Wiradjuri Wabikal country. And I'm a social worker by trade, I say, although I feel like it's a while ago now that I was working in social work. I've always worked in the local Aboriginal and Torres Strait Islander community, and I've done some work nationally in community and welfare work. So I've always worked with the focus on supporting our people in whatever aspect of my career that I've, any path that I've gone down. But I sort of fell into research through a job that was advertised like nearly a decade ago now to do a research study on smoking cessation during pregnancy. And I was a smoker myself and I quit to have a baby. So it was something close to my heart. And when I came into the field, I realised there's a lot of research being done on Aboriginal and Torres Strait Islander people, but a lot less of that is done being led by Aboriginal and Torres Strait Islander people and communities. So I quickly became very passionate about rewriting what is usually quite a deficit narrative about our people and really drawing on our strength as people to generate our own evidence to inform policy and practice.
So does the program Which Way Quit Pack specifically target Aboriginal people, or can anybody use it?
Which Way is all built for and by Aboriginal and Torres Strait Islander people. So we have had some people ask if non-Indigenous people can do it, but at the moment we don't really have enough funding to be able to do that. Our work is focused on our Aboriginal and Torres Strait Islander community, but I've said previously that our hope is that with evidence drawn for and by Aboriginal and Torres Strait Islander people, into the future, programs for every Australian can be driven by Indigenous-led evidence, which is what we're doing here.
What inspired the creation of the program specifically?
Well, community inspired and directed the program. We were doing a different project, but sort of similar type of work with community partners through our Aboriginal Health and Medical Research Council of New South Wales. And during a Zoom meeting with a whole bunch of Aboriginal health workers at different Aboriginal health services across the state, they started to ask me, if you're the expert in tobacco, what helps Aboriginal and Torres Strait Islander people quit smoking? It's a really simple question, but we actually didn't have the answer for that. We knew different things people had offered Aboriginal and Torres Strait Islander people, but we actually didn't know what was effective. So the first iteration of Quit Pack was us drawing on some effectiveness around mail-out support and putting everything that was already available in a box. And we also added nicotine replacement therapy like patches and gum, but the evidence was telling us that not many Aboriginal people wanted that. So we literally just put together in a box everything that already existed, and that was about informing us what people used and what people liked. And that trial blew our minds and our bank accounts because nearly every Aboriginal and Torres Strait Islander person wanted nicotine replacement therapy, which was not expected. But also we had funding for the first iteration of it for 90 people, and we thought it would take nearly 12 months to do that project. And we had 165 people sign up to the program in 3 months, and we ran out of money and we ran out of resources quicker, which is just not common in Aboriginal health research. So now our next iteration was drawing on what we learnt and then expanding broader across New South Wales, Victoria and ACT, and we've supported over 740 Aboriginal and Torres Strait Islander people over the past year and a half in that program. And now we've just been so lucky to be successful in bringing this nationally, but also for us to generate the evidence of how much does it cost and how could we embed this program into everyday systems to support Australians.
What makes the Which Way Quit Pack program different from other smoking cessation programs out there?
Well, as we said, it comes for and by Aboriginal and Torres Strait Islander people, and that's not just me alone. I can't do the work that we do just by myself. I have a whole team of incredible Aboriginal and Torres Strait Islander research team members, some that are almost completing PhDs and some that are community researchers, and all of the promotion, all of the implementation, the people on the other end of the phone supporting people quitting, it's all Aboriginal and Torres Strait Islander people. So we have a really big buy-in to our work because there's a lot of trust there. We have really strong relationships and we really honour those relationships and make sure that we aren't just people sitting in a university desk, but we are also people out there in the community talking to people. We're generating some social media content so people can see us and hear from us and, build relationships with us. Even though we are a research team, we like to think that we're more of a community sort of engaged research program.
So the resources in the pack are really culturally specific, aren't they? They draw on the experience of First Nations people and inform the quitting process from that point of view.
Yeah, and they're also informed by what people have asked us. So we know what the most common questions are from Aboriginal and Torres Strait Islander people when they're wanting to quit, what sort of challenges or roadblocks might come in their way, and we've really tailored, and we continue to build new things every week, really, and new content regularly that really address the questions people have to support them. And all of our Which Way program is not just about informing of, the health effects of if you're smoking or vaping. It's really about empowering people to make a decision that sits right with them, and that people have multiple options and multiple sort of time points that they can get support in a way that suits them to become smoke or vape free.
How broad is the Which Way program? Does it look at a lot of different health aspects?
We do look at a lot of different health aspects, but we've also been developing different types of programs for different demographics. So we also have a program that's just launched quite literally this week called the Goolaba Project, and that is focused on our Aboriginal and Torres Strait Islander women who had told us they were interested in group-based support. So we've developed a group program that Aboriginal Health Services in New South Wales can partner with us and have all the training and the resources to deliver groups in their community. We've also been successful with non-research components too, and ways that we can translate the things that we've learnt in our research to real-world settings. So we've been successful in some tackling Indigenous smoking funding for their priority program, and we have nationally, we're going to be rolling out a women's kit, which is to support Aboriginal and Torres Strait Islander women when they're pregnant to be able to make a quit attempt, and also a youth vaping program that health services can sign up to nationally and download a 4-session program which has been carefully co-developed with 2 Aboriginal health services to educate our young children about the harms of vaping and hopefully stop a next generation in taking up a substance that, if used correctly, will harm our health and potentially kill us.
You referred earlier to some questions that people ask that inform the Quit Pack, that you provide resources for based on the questions that are coming from communities. Can you tell us some of those questions?
They're asking a lot around not just the health effects, but how to work through triggers or their own scenarios that might be impeding their ability to make a quit attempt and succeed and stay smoke-free. So we know that Aboriginal and Torres Strait Islander people are more likely than non-Indigenous people to make a quit attempt, but we're less likely to succeed. So what we've been focused on is building some sort of reflective tools that people can use when they're planning for their quit attempt or when they're in a quit attempt to be able to address their particular circumstances. So we've developed our own quit plan, which seems pretty simple, but it's not usually tailored to a different individual person's needs, or people might not have ever done one before, but to really start to think about their own scenarios and what has worked in the past for them, what has been a challenge, what kinds of things might trigger you to want to smoke, and then giving guidance and ideas of, well, how can we get through a craving? How long does a craving last? What sorts of strategies might you want to do when that craving arises? So we're not sort of trying to only address something when we're in it, but also planning for the future.
Coping strategies you're giving them.
Mm-hmm. One of the things that we really advocate for in our women's program is weaving. So a really amazing way to connect back to our culture, create something wonderful, but also keep our hands busy when we're getting through a tough time or withdrawals and cravings, is to weave. And so we give women kits that are made by an Aboriginal business called Nyampi Weaving. We give them kits and some instructions of how to do weaving to help get through that craving, but also reconnect with our culture and our cultural strength.
That's wonderful. Can you explain for people who haven't realised that they're not exactly the same? I mean, smoking a cigarette and vaping, they're not getting exactly the same particulates through their system, are they? So how do they differ?
They differ a lot, and a vape between vapes differs a lot. And so in our youth program, one of the first sessions, we teach young people that no two vapes are even the same. So we actually have a lot more unknown, and a big thing to remember with vapes is they're not a standard TGA approved product. So a tobacco is pretty much a stock standard product. Even though it's harmful, you kind of know what you're getting. With a vape, we actually don't know what we're getting. And so a lot of young people were marketed towards to pick up vaping, and it was, oh, there's no nicotine in these vapes, so you won't get addicted. This one's just fairy floss. We've actually had groups with our Tackling Indigenous Smoking program test vapes that were sold to be non-nicotine vapes and find that there actually is nicotine in those vapes. So young people are getting addicted to them, but they actually also have a whole range of other chemicals in them that are harmful, and we teach this in our youth program. It has brake fluid in there. It has weed killer in there. So there is a whole lot of health effects that we actually know very little about right now, because it's still pretty early for us to have the rigour of understanding of the long-term health effects from vaping, but we do know that it is not a safe product, that it's not a recommended product, and that it is still harmful in similar ways to smoking.
I wonder if there are different reasons for why people choose one over the other.
Yeah, and we also have a lot of people dual using. So we have people and we know this from some of our early QuitPack data that we've been analysing, because community want to know a lot more about vaping. Who's vaping and how are they vaping, and what sorts of ways are people engaging with vapes. And we have learned that some people who are smokers, because the price of cigarettes has gone up so much, some of our smokers are in between maybe a pay period, they'll be vaping in between those periods. And we know that men are more likely to use vapes and cigarettes together than women. But we do still have people of all ages, predominantly younger people, and people in more urban areas are more likely in our Aboriginal and Torres Strait Islander cohort to be vaping.
And what about smoking in general? Do you have some figures on that?
Our smoking rates are declining among the Aboriginal and Torres Strait Islander community, but we are still 3 times more likely, approximately, to be smoking. Some of the latest data that comes out to talk about smoking rates doesn't classify vaping in a smoking statistic. So we are somewhat being fooled in that saying, oh, smoking rates are coming right down, but it's not accounting for people who might have switched to vaping.
I'm talking today to Associate Professor Michelle Kennedy, National Health and Medical Research Council Fellow in the School of Medicine and Public Health at the University of Newcastle. And we're talking about the Which Way Quit Pack program, an Indigenous-led quit smoking program tackling smoking and vaping. Have you seen any measurable outcomes or success stories from the program already?
We've seen lots of outcomes, and we still get text messages from participants of our program, which is very uncommon for a research program to get updates. We'll regularly get updates with people showing us what they're now using their money on, people that have got engaged, couples that have quit together, telling us that, you know, they're a year smoke-free now, and it's because they had support from our program. So one of the things that helps get us up every morning and keep working as hard as we do is that we always get the good news stories. We have people who have started businesses with the money and the time that they've saved from not smoking. So we've had wonderful success. In our previous pilot, we're still analysing the data from the most recent one. In our previous one, though, at the end of our program where we supported people for 10 weeks, 57% of the people we followed up were smoke-free at the end of that time point. And nearly a third of people were smoke-free at 6 months when we checked in with them again. So we're finding really great success rate, more success than any other smoking or vaping cessation program that's been implemented to date.
Do you continue contact with people who have taken the program, and is it beneficial for them if you do stay in touch?
Yeah, it's definitely beneficial. We also recommend Quitline. So we're not trying to replace any program that's already in place, but we also realise that they function differently. So we know that people really like being able to text message. So we'll have people text and say, you know, the patch is giving me an itch, or they didn't like a mouth spray and they might have been using it wrong. So we're finding that engagement, people like being able to send a text to a line and know who the people are on the other end of that line. So there definitely is a need for a service that is continual, people can come in and out of, rather than, you know, it's not a one and done sort of scenario. Anyone that's been a smoker and tried to quit knows that very, very infrequently is someone going to be able to quit one time and then just stay smoke-free forever.
Yeah. The success stories is something you must be very proud of, but is there an aspect of the program that you're particularly proud of or that's received a special positive feedback?
I mean, I think everything is incredible of this program, but the two people who we say are the poster people of this program were two students at the University of Newcastle that I gave jobs to sort of help them while they were studying, but also give them experience in research, Zabawi Mills and Caden Roberts Barker, and both of them are what I think is just such that heartfelt thing to see them and their growth. They've been here for, you know, Caden this will be the third pilot of QuitPack, or the third trial, of QuitPack, and Caden has been here for all of those and will likely go into a research track from here. So it's also the people that are behind it that is so much success for me, watching their growth and their leadership in research as quite young researchers too, and, you know, being able to celebrate their success as well while we're celebrating the success of our participants has been really, really amazing.
So the program's established now, right?
The program isn't established. We've received money to do the last sort of national scale up of it, and the findings from that funding that we've received will inform what we need to ask the government for the sustained program. So the sustained program probably won't sit within the University of Newcastle. We're partnering with the National Body for Aboriginal Community Controlled Health Organisations, NACCHO. So they will likely be the person who informs or facilitates the tendering or appointment process for who would, you know, carry the program long term. It's our job to really make sure we understand how much it will cost, what the potential impact will be, the economic impacts of a program like this, and then we're able to properly inform the government to sustain a program.
This year's World No Tobacco Day focuses on protecting future generations, so the Which Way Quit Pack program certainly contributes to that goal, does it not?
Yes, we sure do. I mean, not just in QuitPack, but in our Goolaba project, focusing on our pregnant mums and bubs. In our youth vaping program, we're targeting our youth. And then QuitPack is really for anyone in the Aboriginal and Torres Strait Islander community. So we are completely focused on supporting our next generations. And so many of us are also mothers and aunties and uncles. So it's very close to our heart to make sure that we're changing the lives for our next gen.
How can governments and health organisations or even individuals get in and support people on their quitting journey?
Well, I think the number one thing is not to shy away from the quitting conversation. I know that I've had people say, "Oh no, Michelle's coming to talk to us. She's gonna hound us about quitting smoking." And the Which Way team is not about that. We're about saying you can make whatever choice you would like to make for your life. But if you do want to quit, we're here. So you might not be ready to quit today or even have a conversation about it today, but I will always be here to have that conversation with you. And if there is a time when you do want to quit, we will be here along that journey with you. All of our communication and things that we develop as a Which Way team, we tell people that we're here for every step of the way, and whatever stage you're at, that we are here for, and we've developed something for you. So I think the message to everyone is to say that it takes some hard work and some kindness and compassion, and sometimes to just be there as the person to say, I'll still be here to have this conversation with you next time I see you, to check if you want to quit. Because a lot of women, when I did my first ever research study in my PhD, and the conversation was that Aboriginal and Torres Strait Islander women didn't quit smoking during pregnancy. When I went and spoke to women, they said, no one ever told us to quit. No one ever asked us. So, my first ever advocacy work was about saying, we'll just ask our women, tell our women that it's the best thing for them and their bub to quit smoking during pregnancy. So I think the worst thing is people thinking, oh, they're not ready to quit, I'll just not say anything. Please do have that conversation, because it is so important to someone starting that journey.
This program's heard in a lot of rural communities around Australia. What would you say to people who haven't thought about quitting, especially pregnant mothers?
Yeah, well, we would always direct them to our Facebook page or Instagram page or our website at whichway.info, because we have a range of different ways that you could get quit support. But people everywhere, I believe that we should be advocating to be smoke and vape free, because it's not only very expensive now to smoke, but it's also the best thing for our health and well-being. We know it's killing half of our elders. So if we can start to change that within our communities, we will give our kids and our grandkids longer time as a community and with elders as we go into eldership too.
How can people access the Which Way Quit Pack program, and is there a way to get involved to support it?
Yeah, absolutely. So on our website, we have a page for it. And so whichway.info, people can submit an early EOI. We won't be open yet for our national program, probably till the later half of this year, because we'll need to reset up all of the work and get a bit ready for that. So people can submit EOIs. Also, organisations. So if there's an organisation, a health organisation that says we want to make sure that we're able to promote QuitPack when it's back up and running, if they submit an EOI, make sure we send out posters and promotional material to you when it is relaunched.
Whichway.info is that website, yeah?
That's it.
How long do you think it might take a program like this to become so part of society that we kind of all know about it, that the changes it recommends become commonplace?
Yeah, I think we have societal change around knowing smoking is bad. And I think we have societal change because of our Tackling Indigenous Smoking program, that people are thinking about quitting or not wanting to smoke anymore. I believe that we've achieved those things, which is wonderful, and we want to maintain things like the Tackling Indigenous Smoking program so that we keep that up and we don't lose that momentum. But I think what we need is some really solid supports in place so that when there is someone who wants to quit, that they know where to go to. And that's really the biggest barrier is that, and we still get emails almost every day with people saying, we want to quit smoking. Is your program up and running? How can we receive support? So I think once people know there is some set core programs in place, I think we will see enormous changes in smoking. We've seen that in both of our QuitPack studies before this big national rollout where we haven't been able to keep up with demand. So that for me is an incredible outcome. I know that as soon as we have the ability to support more people and across the nation, we're going to see enormous quit rates, but we need to have a sustained program to be able to have that societal change long term.
Can you share with us some of your future hopes and goals, not only for the program, but for Aboriginal and Torres Strait Islander health in general?
My biggest hope and goal is that there is some investment in cessation. There really isn't a lot of funding available to run cessation programs. So when we're rolling out our women's group-based program, and that's where the research really comes in, we're trying to understand, well, how can we sustain this? How much does it cost to run this? What do we need to ask for? And with QuitPack, we need to have it as a standalone program that exists long-term to see that. So, my biggest goal is that we have more investment and attention paid to cessation because it's really a very difficult journey to do alone, and we don't have tailored supports available across the country for Aboriginal and Torres Strait Islander people to support them to quit.
Thanks, Michelle.
Thank you so much.
We really appreciate that you took the time to talk to us today. I've been talking to Associate Professor Michelle Kennedy, National Health and Medical Research Council Fellow in the School of Medicine and Public Health at the University of Newcastle. That web address again is whichway.info. Thanks for listening. I'm Graham Wilson, and all of us at Wellbeing wish you well.